So my name is Imran Masood. I'm a glaucoma specialist and I work in Birmingham in the United Kingdom. When I'm treating patients with mild to moderate glaucoma, my go-to intervention initially is SLT laser, to be honest, and I think that it is effective in a large proportion of patients. In terms of surgical interventions, I would tend to go with the eye stent or other canal-based therapies because I think the canal is a very safe place to perform surgery. You are limited in terms of how low the pressure is going to go, so that's actually very beneficial in terms of considering complications such as hypotony. So I would say that the eye stent or canaloplasty is what I practice, and those are the procedures I go for in patients with mild to moderate glaucoma who need surgical intervention. Early intervention benefits the patient in that the patient's medication load is reduced. Putting in medications for a disease which in its early stages is asymptomatic is actually quite difficult. You know, if the patient has to remember to put the drops in, sometimes patients find it difficult to actually instill the drops. Putting eye drops in is not an easy thing to do. So if you can reduce that burden on patients, it obviously helps the patients. It helps ophthalmologists because I think that patients who are on less medication, who subsequently need further glaucoma surgery, employing the conjunctival or the external route, that conjunctiva is in a healthier state, and therefore I think those subsequent operations work better. In terms of the benefits for the healthcare system, I think it ultimately means patients are not reliant on eye drops to control their pressure, and therefore their pressure is better controlled. Perhaps it means in the longer term less patients will succumb to visual loss from glaucoma, which is beneficial for society overall. Cataract surgeons performing MIGS surgery, so these are cataract surgeons who are not formally glaucoma trained. I think it's all about training, accreditation. Ultimately, whoever performs surgery on patients has to have the training, has to be able to do it well, and has to do the surgery safely. I think that providing cataract surgeons go through a period of training in glaucoma. I think there has to be some glaucoma training because you have to learn to visualize the angle. So certainly the eye stent, hydrus and canaloplasty, you do have to have experience of gonioscopy and therefore need to understand what the angled structures are like in the clinic before you start using that knowledge in theatre for your surgical procedures. So I think that in summation, I think it is acceptable for cataract surgeons to be doing such surgery, providing they have the training. I don't think that cataract surgeons who have no training should start using these procedures on a whim. I think you need to be adequately trained to do it.